And action. George had a question about HDL. That stands for high density lipoproteins. HDL is one of the blood tests that we get when you come in for the annual checkup. That's the reason why you have to get a fasting blood test. And there are other things that we get in addition to that as far as cholesterol. And typically, a standard blood test will include an LDL, that's low density lipoproteins, triglycerides or trigs, and then total cholesterol. Sometimes they'll even put a ratio there. So those four tests are pretty standard, and that's usually supposed to be used as a metric for seeing how your health is. And then there's other tests that we do get in addition to the cholesterols like sugar or glucose, kidney function, liver function, thyroid function, and they usually are pretty good for assessing how you are manifesting your life in the form of blood tests. Now, we can't just look at the blood test and say, you're healthy, go away for a year. I mean, I had a lawyer work on some paperwork of mine, and the legal assistant came in and said the last time she had a checkup, her doctor said she was healthy. Now, she also, as she passed behind me, was short of breath, walking like this, and she was obviously overweight. So I'm not doing this to point the finger at her, but how dare her doctor say that she's healthy? And so that's a doctor that's just looking at blood tests, and you should never just do that. If we as doctors can also check and make sure that you're doing everything properly as far as your lifestyle, as far as movement, as far as nutrition planning, as far as mindful practice and quieting down or stress relief, as far as how sex is going, erection, how the hair is going, how the weight is going, if you're feeling frustrated, all those things are important. But sometimes in a 15 to 20 minute visit, they get left out, especially if we're pressed for time and all we have time for is just to look at blood tests, and we'll just treat the blood test. But that should never be the way medicine is. Unfortunately, that's the way it is now in the United States. So, just getting to HDL. What some of my patients have come to see me for is lifestyle change, but then when I ask them about their cholesterols, they'll say that their other doctor said it was okay. The high cholesterol, the total cholesterol came back okay, high, but it was okay just to watch since the HDL was really elevated and the ratio was okay. So again, we use that as a metric. So if life is out of balance, what I would do is look at the other parameters first, like I just mentioned to you. Now, there are some people who follow the standard cholesterol testing. Dean Ornish was the first doctor, he's Clinton's doctor, who came up with the results of seeing how mindful practice, group therapy, yoga, and a mostly low-fat vegetarian diet will be able to reverse the narrowing of the coronary arteries found on ultrasound or on testing of the heart. And that was direct visualization and direct improvement on the visualization test. And in theory, those patients would decrease their chances for heart attack. In fact, a couple of them that he included in his study were folks who, for some reason or another, did not get on the list to have bypass surgery, and they had to go conservative. And he found great results, which was one of the first steps in the 90s to say that we don't have cholesterol disease as being permanent. We used to think it was permanent. Once you have it, then that's stuck. But now, with his efforts and then the research of many other doctors, we see that you can reverse disease. And some would even say that it's more inflammation than anything and not a cholesterol issue. So I think Sinatra's book is great. A patient, John, gave me this book, and I found it very interesting. And I do agree with a lot of the concepts of having cholesterol and plaque not necessary, or cholesterol isn't necessarily the reason for the plaque, it's more the inflammation from the other crappy food that we eat as Americans. And I think there's a lot of validity to it. But again, I wouldn't push away the blood testing as saying it's not worth any value. I think it's a good metric. And there's also other things that we consider. So if you're trying to decide on whether you have to be on a statin or not, well, make a lifestyle change first. And again, the shortcut is to follow what Dean had suggested, and his book's easy to read. But not too many of my patients like low fat. I'm not sure I totally agree with low fat, but I think it's just to initiate change, and that's fine. If you are on the fence about using a statin or getting off your statin, sometimes getting more workup as far as there's things called fractionated lipoprotein panels, and where they look at ApoB, ApoA1, CRP, LP little a. All these things are further breakdowns of the big fluffy LDLs or the small dense LDLs or the other HDLs. So the standard, in addition to the not so standard, might give you a better metric to decide on what you have to do. And honestly, most of us have to do a change of some sort. The question is whether you are in harm's way of having a heart attack soon because of stenosis. And sometimes when you have all these factors together, in addition to a heart disease history in the family, in addition to chest pain, you might want to rid yourself of cholesterol quickly. Again, looking or taking into account that some of those studies from before that say cholesterol always equals heart disease might have been a little off. But I have patients who have normal cholesterols and still have heart disease and heart attack. In fact, a patient of mine who is watching his cholesterol with natural means just had bypass surgery. And so that's why it's important. There are people who fall below the line, people who fall above the line, but the bottom line is that you really have to have a healthy lifestyle, well-rounded. Exercise, mostly whole food, plant-based dieting, and relaxation practice. If you don't, that's when you use the blood test to figure out what else do I have to change or how do I change it. So that's why these things are nice as metrics. So if you initiate a change and you see these things change, like say you take on the ketogenic diet, or you do gluten-free, or you do fasting, intermittent dieting, whatever you choose. And I have had patients lower their cholesterol with all three types of dieting practices I just mentioned. But if you do those and invest and you like it, well, you should see a change in your weight and your numbers. If you don't, then I might reassess and try something different the next time. But stick with it until you see a change. If you notice a change that you're feeling better, then you win. It'd be nice if the blood test showed. Sometimes what I'll see is if my patients make initial changes and they feel great, like they haven't felt in a long time, then I might wait. If they're low risk for heart disease, I might wait to pull the trigger on pulling a statin into their pockets. And usually what I'll see is after about a 12-month to 18-month period, these things drop, these numbers drop. But you might have to be very patient with that and just keep on practicing that healthy lifestyle. So the statins are usually a reflex. When we see, as doctors, a high cholesterol, we'll give a statin prescription. In fact, the studies now show that if we're going to give a statin prescription for somebody that's high risk, it should be the highest dose of the statin. So now we're not even starting with lower doses, we're going straight to 40 milligrams, highest dose, which I have a problem with. So I would always say lifestyle first, and then if you can't make the lifestyle changes, then yeah, I think that we as doctors have to say, let's try the statin just to lower the number. But the side effects are there too, because cholesterol is an important thing. You produce your own cholesterol in addition to you eating foods that are high cholesterol, low cholesterol, but it's the cumulative effect of what you produce and what you eat that gives you numbers. Now, as far as whether these numbers cause disease or not has yet to be decided. But I can have, as I mentioned, patients who don't have cholesterol issues have heart attacks. I also have patients with very high cholesterols that don't have any problems thus far. Knock on wood, they don't have any problems yet. But I would always say if you have a really, really good lifestyle setup or practice, then we stick at it. Sometimes what you can do if somebody is really pushing you to get on a statin because your cholesterols aren't changing, then you can also have tests done. There's calcium scores that can be done. That's the ultra-fast CT scan. It looks for calcium deposits. And there is an algorithm that with the amount of calcium that you see on a CT scan of the heart, about how that translates to potential risk for heart disease later on, assuming that the plaques that you have that narrow the lining of the coronary arteries also have calcium deposits. You might be able to correlate that. And that's non-invasive. It's like $50 in the month of February because that's heart month. It's essentially it's cheaper than 2 dinners, so it's worth the investment if you're still on the fence about whether you have to pull the trigger or not. There's also stress testing. I wouldn't get stress testing by itself. That's when you get on a treadmill under the eyes of a cardiologist and a nurse. And even if you're a marathon runner, we still have marathon runners that have heart disease, and they do great with marathons. Jim Fix or Alberto Salazar, both of them, you really should consider looking at their stories, because Alberto Salazar was the most recent. He had bypass. Fix died, but Salazar was teaching. I think he was teaching at a Nike camp, and he went down on one knee while he was coaching, and he woke up with, I think, four bypass vessels in his chest. And that's a marathoner who set the pace in Boston and New York. So just because you exercise and maybe you can do well on a treadmill does not mean that you don't have heart disease. This does not alienate anybody. Nobody's immune to this. So you really should consider a stress test. Again, if you pass a stress test with flying colors, if your numbers are great, then you're probably okay. But if your numbers are bad, your calcium score is high, and your stress test is equivocal, we can possibly save your life. So surgery nowadays is fantastic. I mean, bypass surgery, stent surgery is great. In and out of the hospital in a day, I believe. But the problem is there's still people, it's about 500,000 people per year who have a heart attack. And of the 500,000 people that have a heart attack per year, half of those, their first symptom is the heart attack. They don't have any warning symptoms. So you have to really be careful, especially if you're a woman. Women don't have the typical symptoms that men have, and I'm not sure why, but you just have to be careful. So if you have a whole bunch of risks and you have a whole bunch of tests, those metrics are all pointing to possible disease. Don't ignore it. Finally, there's something called a cardiac catheterization. That's invasive. That's when they put dye in your blood vessels and they see how the map looks of your coronary arteries. That's the exact yes or no that you have heart disease. But it is invasive, and it does have a risk of causing vasospasm in the arteries. That's usually the last thing that you would want done, but there's a lot of things before that. So that's the usual workup, and my suggestion, or the research shows that if you're just trying to figure out if you're healthy enough, how to change your total cholesterol picture, it's always important, or the theory is to increase your HDL. The HDL, lipoprotein, is the carrier molecule that takes triglycerides from, essentially free fatty acids, from the bloodstream and puts it into the liver so it can be digested. The LDL is the bad guy that is kind of fluffy, sticky. It's fat, and it holds a lot of cholesterol, plaques, lipoproteins, triglycerides, and it goes from the liver to the tissues to deliver these things, the cholesterol. And cholesterol is very important for brain health, for hormone fixing. That's why the statins, when they block cholesterol production in the liver, they also cause memory problems, erectile dysfunction. They sometimes screw up on your thyroid blood tests. So statins do have side effects. But if the theory is if you just want to do it naturally, and we're going just by the blood testing, if you increase your HDL, it may eventually lower the total cholesterol. And unfortunately, the information is still iffy there, but what we've been able to find, what the researchers can find, is that usually even if you're a master's level exerciser, that means older than 60 and exercising, usually endurance athletes have a higher HDL than non-athletes. And endurance athletes over age 60 have a higher HDL than non-exercisers under 60. So there is a relationship between high HDL, which is the healthy cholesterol, and exercise. So if you're trying to find ways to conservatively change around this profile, possibly taking the total cholesterol down can be done with increasing HDL. And how do we increase HDL? A whole food, mostly plant-based diet, relaxation practice like meditation, yoga, guided imagery, nature walking, and usually group therapy or exercise routine. And that's exactly what he said to do. So unfortunately, there's no medicines that increase HDL 100%, but there's a lifestyle change. And if you do those lifestyle changes to lower to raise your HDL, then in theory your total cholesterol will go down. But if you're doing all that stuff anyway, that's a healthy lifestyle. So who cares what the total cholesterol looks like, right? It should fall. There's only a rare case when people have familial hypercholesterolemia and or they've had bypass already or stent placement. And those folks, you probably should be on a statin, because that's where the best studies have been reproduced, because that population of people has been really focused. They're under scrutiny, and they have shown that that's where statins would be helpful, understanding their side effects. But for everybody else, I really think that you can change things by changing your lifestyle. And if you haven't been able to change your lifestyle, or if you're an athlete already and or a vegetarian and you still have abnormalities, maybe it's a matter of getting the fish oil. Sinatra has touted omega-3 and omega-6 balancing is really important. And I think even if you are a vegetarian, you still have to balance omega-6 and omega-3. We take way too many omega-6s. We don't take enough omega-3s. Sometimes even if you're a vegetarian, you might not be able to do that. So just go ahead and take it. Mercola likes to use krill. I think it's a little expensive. It does work a different way than standard fish oil, but bottom line is if you can increase your total omega-3 intake to 2,000 milligrams twice a day at least, that'll be enough usually to change the ratio around so that you have less inflammation. Less inflammation means even if you have cholesterol that's low, then the cholesterol will not stick to the lining of the blood vessels, and that prevents the plaque formation, which is the first sign or the first step in stenosing off or narrowing down the artery that leads to a heart attack. If you have high cholesterol but you have no inflammation, technically the high cholesterol won't stick to the lining. You won't have any narrowing. So that's where I'd leave this. I say if you want to build your HDLs up, get on that diet, try to exercise as best as you can, or at least try to get to the point where you can find a sustainable exercise program, a sustainable whole food, mostly plant-based diet, and a sustainable form of mindful practice. Then you should be okay. But whether at that point in time, again, who cares about the cholesterol levels? It's going to be a lifestyle that will keep you out of harm's way as far as stroke and cancer anyway. And hopefully you get to that point. If you don't get to that point, then you probably should hire a coach, either the head coach as far as your doctor, integrated medicine doctor, or smaller coaches in the form of a physical therapist, personal trainer, life coach, nutrition coach, and mindful practice coach or psychologist. Now, if this is the first time you're finding me, then please subscribe and you get the alert button also clicked so you can hear when I put out new videos. Otherwise, hopefully this does help. If you have any other questions, then just post them down below. Otherwise, I'll see you in the clinic.